Welcome back, everybody. Several of you asked me to make a video on how to use a derma roller. So in today's video, I'm going to show you how I personally medical microneedle my face, neck and chest with a derma roller. I will talk about do's and don'ts as well as aftercare. And by the way, if you're new here, I'm Claudia. I'm so happy you're here. Welcome to my bathroom. Please remember, I am not the authority on derma rolling or microneedling. I am only sharing my own experience with you. So please, always do your own research. And with that said, let me put up my hair, wash my face, and let's derma roll together. All right, hair is up. And that's one thing I wanted to mention. I have seen people derma roll or microneedle with their hair down, and their hair keeps falling in their face while they are microneedling or derma rolling. Personally, I don't think that is a great idea, because when we microneedle or derma roll, same thing, it is really all about sanitation. So if you have your hair falling in your face while creating tiny little punctures in your face, I don't think it's the best idea, in my opinion. So I think putting your hair up or wearing a headband is a good idea. So to wash my face, I'm wearing a lot of sunscreen right now. I'm going to double cleanse. I'm just going to use a cleansing balm and then a gel cleanser. Let me do this real fast. I'll be right back. All right, my face, neck and chest are thoroughly cleansed. I also use some Aven thermal water to wipe everything down. Personally, I do not use alcohol to wipe down my skin. Many people like to use alcohol before derma rolling or microneedling. I don't. But if you feel more comfortable, by all means do so. And please make sure, if you have any sort of active infections on your skin, any acne, any yeast, anything you're not sure about, please do not microneedle or derma roll, same thing, because you could be spreading the bacteria and pathogens. Now, if you want to use numbing cream, now would be the time to put on numbing cream. Personally, I don't use numbing cream. I just don't like that extra step. But if you use numbing cream, put it on, let it sit there for a while, then make sure to really wash it off well. You do not want to microneedle any of the numbing cream into your skin. So I actually purchased 2 different derma rollers. I haven't used a derma roller in years now. I have been using a machine called the Derminator, which is similar to a Dr. Pen. But because you wanted this video, I purchased a derma roller. Now, normally when I microneedle at about 1 millimeter depth. So I purchased a 1 millimeter derma roller, and then I remembered that using a derma roller is a bit more uncomfortable than using a microneedling machine. So just in case, I also purchased a 0.5 millimeter. So I'm going to start with the 0.5, see how it goes. If it's not too bad, I might switch over to the 1 millimeter. But 0.5 is already considered medical microneedling. So deeper is not always better. I normally go at 1 millimeter, especially right here where I'm a bit sunken in, because it is harder to get to. But like I said, let me start with the 0.5. Actually, this is the 0.5, and let's see how it goes. So I haven't even taken this out of the package. So it is completely sterile. And if you buy a derma roller, sorry, this is loud. If you buy a derma roller, make sure it is a good derma roller. I will link this one down below in the description box, and also a couple other ones. But make sure to not just go on eBay or Amazon and purchase something for a couple of dollars, because most likely they are not good quality. You want to make sure that the needles are either stainless steel or titanium. And if you purchase a cheap derma roller, oftentimes they are not. And they're actually not needles, but little metal wires, and you can really hurt yourself. So make sure it is a good quality derma roller. So let me open this one up. So if you purchase a brand new one, they are sterile. You do not have to sanitize it, but sanitation afterwards is very, very important. Sanitation when it comes to at-home microneedling is really, really important. We are creating tiny little puncture wounds. So they are open for all kinds of pathogens, bacteria to enter. So we have to really make sure that everything is nice and clean. My hands are washed. I do not wear gloves when I work on myself because I don't feel the need to. If I wear gloves and then touch something with them, they are just as contaminated as if I was to use my hands. So I always have a bit of alcohol right down here and a cotton swab. And if I happen to touch anything, I will just wipe my hands down. So let's get started. So one of the nice things about using a derma roller is that you do not have to put anything on for slip. If you use a Dr. pen or determinator, you need to put something on for slip so you do not scratch yourself and the machine or pen actually glides over the skin. With a derma roller, you don't have to do that. So here is what I personally do. I'm going to come a bit closer and I will look behind you in the mirror. So if I don't look at you, I'm sorry, but I gotta see what I'm doing. So what I do is I start right here. I go all the way up vertically and I'm not putting a lot of pressure. I'm just sort of guiding the roller. And then I will set it right next to it and do the same thing again. And I can already tell this is not painful at all. So I will actually open up my 1 millimeter. All right, we have the 1 millimeter. So I'm going to hold my skin kind of tight. Now, if you're really young and you don't have a lot of loose skin, you don't have to do that. But I don't have that luxury. So I'm trying to hold my skin really tight. And again, I'm going up, not applying any pressure. Then I'm just setting the derma roller right next to it, going back up again. So I'm slightly overlapping, but I'm not going, so if this is the path I just took, I'm not overlapping completely, but I'm sort of setting it right here. So I'm overlapping about 2/3, but not all the way. And I'm going to go like that all the way until I hit my nose, and then we're going to do the same thing horizontally. Again, I'm not applying a lot of pressure. That's important. You don't have to drive that thing into your skin. So I'm going to go up again. And I'm just going to go to my temples because I will do my forehead separately. And then I'm lifting, going back down again, setting it, overlapping by about 2/3, coming up, lifting, coming back down. So it is really important that you don't roll back and forth. And I actually did a little experiment for you on my arm where I used a 1.5 millimeter actually, just to make sure it is actually visible. And I went back and forth on my arm, and here's the picture of what happens. And unfortunately, it is not even that visible in the picture, but hopefully you can see the scratches it created. And then in this picture, I went up, lifted the derma roller, did the same thing. And you can see there is hardly any visible damage. And that is what we want. We don't want to create scratches or grooves. We want to create tiny little puncture wounds. So make sure to always lift. Do not go back and forth. I would say even when you cosmetic needle, I see people cosmetic needling doing this. I would say even then, why risk it? Always lift your roller, set it back down, and then go back up. So let's continue. So you can see where I'm red. So, you know, the 2/3 overlay is just sort of I can't think of the word right now. It doesn't have to be exact, but you just want to make sure you're not over treating an area. So we don't want to turn our face into hamburger meat, but again, we want to create tiny little puncture wounds, leaving the rest of the skin intact so that the rest of the skin can help. And I'm not going past my orbital bone right here. So I'm stopping right here, lifting and going back down. So we want to keep the rest of the skin intact, just creating tiny little puncture wounds so that the rest of the skin can help heal the damage we created. So this is similar to a fractional laser. When you get a fractional laser, you are creating injury to just fractions of the skin, leaving the rest of the skin intact. So again, the rest of the skin can help heal the injured area. So I'm almost here. And if you have any doubt, if you're over-treating an area, I would say less is more. This is something you want to do for the long run. I know when you first get started, it is very tempting to go a bit crazy. I did the same thing when I first got started. But we don't, again, want to create too much injury. There is no point in turning our face into a hamburger. We want to create a bit of inflammation, a bit of injury, but not so much that the body can't actually heal it, or that it takes forever to heal and we're actually creating damage. So I have covered everything now vertically. Now I'm doing the same thing horizontally. Again, holding my skin tight and just gliding over my skin, hardly applying any pressure. Slightly overlapping, but not too much, and always making sure I lift my roller up in between. And I'm going to make some weird faces to have my skin tight. And you can kind of, I don't know if you can hear this on camera, you can kind of hear the needles go into the skin. It's a strange sound. Again, I'm not going past my orbital bone. I will do my eyes separately, but I will use the 0.5 for that. So I basically have covered all of this area. So again, better to undertreat than to overtreat, in my opinion. Some people like to go after going vertically and horizontally in a star pattern. I think that is too much inflammation. I think this is plenty. I have created some nice erythema. I have a little bit of puncture wounds. So this is plenty. Now I'm going to do the same thing on the other side. There we go. So it really doesn't take that long to treat an area. Again, this is my opinion. I think it is better to undertreat than to overtreat. I have, again, plenty of erythema. I have some pinpoint bleeding, and I have more pinpoint bleeding where my cheekbone is, because the bone is right there. So it does make it a bit easier to bleed. But in my opinion, this is plenty. Now I'm going to do around my mouth, which is usually for me the most painful, as well as my chin. Again, I'm going to make some faces to make sure this is nice and tight. As you can see, I am not, again, completely overlaying, but about 2/3. So there's always about 1/3. So we're not creating too much damage, but we're still making sure we're covering all the areas. And always lifting off in between. There we go. Now I'm going to do the lip. Oh, I don't like that part. Hold on. That part is definitely uncomfortable. Okay, horizontally. And when you have a small area like above the lips, it's hard to do the overlapping the way I just explained it. So if you cover it a couple of times, that's okay. Just again, don't go crazy. We don't need to cause too much inflammation and too much damage. Here we go. So again, I got some good pinpoint bleeding, some good erythema. Now, I never microneedle my nose, but of course, if you want to microneedle or derma roll your nose, same thing. Make sure you're lifting off in between. So let's do the forehead. And I actually thought that I was going to go to the 0.5 on my forehead. but it is not too bad. But you can definitely see I am getting some pinpoint bleeding here. And again, always lifting in between and making sure to not apply too much pressure. I'm also going to go over my eyebrows just a couple of times because that really helps grow some of the brows back. I overplucked in the 90s. And now let's go horizontally, and I'm just going to go halfway and then to the other half. Again, overlapping some, but making sure to not overtreat. Now I do the same thing right here. And this is where your nose starts to run and your eyes start to tear a little bit. Here we go. So this is my whole face. Now I'm going to grab the 0.5 and do around my eyes. So I have my 0.5. My hands are clean. I just used the alcohol on it. So I'm going to take my hands and hold this quite tight. You do not want to go past the orbital bone, but I do want to get a little closer onto my eyes to get some of the lines. So I'm going to try to pull this down very gently and then hold it tight. And then same thing, just slightly overlaying here. And I'm actually going to look in the mirror just to make sure I'm not poking my eye out. Slightly overlaying here, making sure to not go past the orbital bone. So I'm just doing tiny strokes here, and then I'm going to go the other way. Just tiny strokes here, just overlaying a little bit. Here we go. So that is one eye. You can see because I pulled it down, I got pretty close under the eye. So same thing here. Make sure you're gentle. The skin here is quite fragile, so be gentle. So again, gently pulling it down. So let me grab the 1 millimeter again, and let's do my neck and my chest. So we're going to do the same thing on the neck. All the way up, lifting it next to it. Lifting it next to it. Or I'm saying next to it, sorry, but overlapping slightly. Being careful around your thyroid area. So I'm just going to do short strokes right here. Forgot a little part right here. Short strokes right here to not get my thyroid. And then I can do longer strokes again right here. In my opinion, the most important thing to watch out for with a derma roller is to not go back and forth. Remember the picture, to not apply too much pressure, and also to not overtreat an area. Okay, so we got all the vertical. Now let's go horizontal. Several of you told me you do not get pinpoint bleeding when you derma roll. Personally, I don't think that is important, and you can see my neck actually doesn't bleed, and it normally doesn't. My forehead actually bleeds quite a bit today, but interestingly enough, when I use the Derminator, my forehead hardly bleeds. I get the same great results with or without the pinpoint bleeding. So pinpoint bleeding, in my opinion, is not necessary. Some people bleed, some people don't, but it is not necessary for good results. Again, really making sure you're avoiding your thyroid here. I can do some shorter strokes right here. This is probably really attractive, you looking up my nose. There we go. Neck is done. Same thing on the chest. All right, that's my chest already. So this was it. This was face, neck, and chest using a derma roller. I have to say, using the 1mm wasn't bad at all. The only place it was a bit uncomfortable was around the lips. You can see I am nice and red. Again, I have some nice pink one bleeding. So what I will do now is wash everything off with just some cold water, and then I will apply my LED light therapy. I have really found that using LED light therapy after microneedling or derma rolling, again, it's the same thing, makes a big difference. It really helps bringing down the inflammation. There is still plenty of inflammation for the body to respond and produce growth factors, collagen, elastin, all the things we're after. But it helps bring down some of the inflammation, and I feel it helps me heal faster. So I'm going to, like I said, wash this off with cold water, apply my LED light therapy. I use a mask, so I really make sure I wipe the mask off well with alcohol. Again, right now I have these open channels, so I have to be very careful. I don't want to introduce any sort of bacteria or pathogens into my skin. And then afterwards, I am going to apply this right here. This is what I always use after microneedling. And actually, when I use my Derminator, I will microneedle with this. This is by Neogenesis, and it is their stem factor serum. This is safe to be used when microneedling or after microneedling. So now is when you want to be really careful for the next 24 hours at least. These channels close up fairly quickly, but studies have shown that they can stay open for up to 24 hours. So now you want to be really careful what you put on afterwards. You want to either use a high molecular weight hyaluronic acid. High molecular weight hyaluronic acid is anti-inflammatory. Make sure it is high molecular weight, because low molecular weight hyaluronic acid can be inflammatory. We don't want to cause any more inflammation. So either use a hyaluronic acid afterwards or a product which is safe to be used when microneedling or after microneedling. And then ideally, you leave your skin alone until the next day. Make sure to wear sunscreen the next day. I always wear physical sunscreen anyways, but after microneedling, you really want to make sure to wear physical sunscreen. I like this one right here. This is by LTMD, and it is for post-procedure skin. Not only does it protect me from the sun, but it also feels actually very soothing because of the high zinc content in here. So what else can I tell you? Make sure you really sanitize your derma roller. Now what I will normally do, I will run mine under very hot water with a bit of soap, because I found that just using alcohol sometimes doesn't get rid of the tiny bit of blood that might be on here and the tiny bit of skin particles. So personally, I have found running it under hot water first with a bit of soap, then sanitizing it with alcohol, I found to be the best. But regardless, if you use hot water and soap first, make sure to really, really sanitize your derma roller with alcohol. Some people also like to use the denture caps. You can put that in some water, then put your derma roller in there. But really make sure to sanitize it. Once it's sanitized, put it away in its little home, and next time you can use it, it is already sanitized. Some people like to, even before they use it, even though they sanitize it after use, they like to still put a bit of alcohol in a spray bottle, spray it on it. You can do that as well, but make sure before you use it to really let it dry well. And also make sure to replace your derma rollers regularly. It's hard to tell exactly when you need to replace it, so better on the safe side and replace it too frequently than not frequently enough. I would say at least every 6 months. If you use it about once a month, that'll give you 6 uses. At the very least, after 10 uses, I would replace it. But again, I would say after 6 uses, better safe than sorry, because you don't want the needles to get numb and then possibly injure you or just not get good results. So replace your derma roller often. Make sure you get a good one. And once you get it, and I actually forgot to do that because I'm talking to the camera, but once you get it, it's a good idea to actually inspect it and make sure all the needles run the same direction. Now, I trust this company, so I didn't inspect it, but it's a good idea because you don't want one needle to run the other direction and then tear your skin. So this is all. I hope this was helpful. And if you have any questions or comments, leave them down below. I always love to hear from you. Thank you so much for watching. I'm, like I said, going to wash this off right now. I will see you next time. Bye. I wanted to come back really fast. First of all, to show you how much the redness has already gone down. It's been about an hour since I derma rolled. Also, one of you had asked me, is it normal to look worse the day after or even for a couple of days after microneedling? And yes, that is completely normal. We just created some injury on purpose and it has to heal. It is also normal to feel dry, maybe even flaky. The best thing you can do is to use your high molecular weight hyaluronic acid, and within a couple of days, your skin will be fine. Another thing I wanted to say, there is so much controversy right now around microneedling, especially microneedling at home. I truly believe anybody can learn how to microneedle as long as we follow certain guidelines. Sanitation, very, very important. Not over treating an area, not going too deep. Deeper is not always better. When I first started microneedling, I thought the deeper, the better. But we create too much inflammation. Deeper is not always better. If in doubt, go less deep. As I said earlier, 0.5 millimeters is already considered medical microneedling. Actually, some people say it's not. Some people say 1 millimeter is medical microneedling and 0.5 is still cosmetic needling. But I like to be on the safe side, and I do believe that with 0.5 millimeters, we already get collagen induction. So if in doubt, don't go so deep, don't over-treat an area. If you use a derma roller, make sure to not go back and forth. Remember, we don't want to create scratches or tears, but just tiny little micro punctures. So as long as we follow all those guidelines, I think anybody can learn or can microneedle at home, and it can be a very safe and very effective treatment. So I hope that this was helpful. I'm going to toss my skin in this right now, and any questions or comments, like I said, leave them down below. Until next time, bye.